Hey there, everybody. Welcome to another episode of The Whole Truth. Thank you so much for joining us. Today, we want to talk about a topic that I get to talk about a lot, and I have a good friend of mine. My friend is Jackie Sittenauer, and we worked together for many years when I was at a different practice, and so she's the perfect person to facilitate this discussion about hormones. Now, hormones are very important in men's and women's health and in their lives and how they're feeling. And I think it's an important subject to talk about because people don't really understand everything that they can do. There are a lot of controversies about whether they're safe or whether they're dangerous. And most people believe, rightly and wrongly, that hormones have a tremendous impact on many aspects of their health and of their lives. And I'm so glad that Jackie's here because she and I have taken care of many patients suffering from hormone imbalances, and so that's what our subject is today.
Yay.
So yes, Jackie, what do you remember as some of the highlights, some of the most common symptoms that our patients would bring to us suffering from when they and they would ask if a hormone might play a role?
Some of the most common ones that we faced: vaginal dryness, loss of interest in sex, weight gain, mood swings, insomnia. I mean, we could list hundreds.
Those are kind of the big ones. Those are kind of the most common things. And the interesting thing is that we expect these changes in people's lives as they're getting older, but it can happen at young ages too.
It can happen at any age.
PMS obviously has a huge, it's dictated by hormone changes in a woman's body. But some of the things that you touched on were really good symptoms, right? So a lot of people struggle with symptoms of moodiness, anxiety, irritability, poor sleep, they can't concentrate. And what age do you think women would, like most common, to start experiencing symptoms?
Most common age, late 30s. But I mean, we would have patients come in early 20s, very abnormal symptoms for their age group. So that's when you want to take into consideration, is it hormones or is there an underlying factor that might be causing it? Because it's not always just the hormones, but that's always the first thing that people jump to. And that's the first thing that they want checked.
Right.
And that's where we come in.
Absolutely. So it is kind of, we always feel like a little bit, all the other health specialties involved loved to just throw out there, oh, we've tried fixing your inability to sleep or your weight, your moods, and it didn't work, so it's got to be your hormones. And it may or it may not. But let me just give a little bit of overview. So hormones are signaling molecules that are produced in various sites by glands in our body. Then they get released into our circulation and they move all throughout our bodies and they interact with receptors on different cells to cause an effect. And so a lot of people think that hormones, and specifically when people talk about their hormones, they're usually talking about thyroid, estrogen, testosterone.
Right.
Yep, progesterone, but there are obviously many other hormones, but those are the ones that we're most able to manipulate and that really do contribute to a lot of these symptoms.
Right, like with thyroid, everyone wants their thyroid checked when they're not losing weight.
Right.
That's the first thing they jump to, oh, it must be my thyroid. It could be many other things, but that's the one thing that they want checked. And once they get those results back, and if they're normal, then it's like, okay, what else can we check to figure out what's going on with your body and why aren't you losing the weight that you want to lose? So it's like a magic word. People think hormones, I'm going to be fixed, or there's that stigma to it as well, like, oh, what's wrong with my hormones? So it just depends on the patient and what they're going through at the time.
And it is important for patients to know, we can always check people's hormones and then measure them. And if their symptoms and their lab results all kind of fit a pattern, then they may be a candidate who may benefit from supplementation with natural hormones. A couple other things that I wanted to address about hormones, why it's important to talk about them, is the controversies. So there are completely conflicting viewpoints in medicine, and the majority of doctors will tell their patients things like, you don't need hormones, hormones are dangerous, and they cause cancer and blood clots and all these terrible risks. And so patients are put in this position of hearing from one doctor how dangerous they are, and from another doctor how much they might help them, and it's a really hard position as a patient to be told these conflicting opinions.
You have to decide on, that's when a patient needs to decide on their own and take back their responsibility of how am I going to feel? And if they've tried everything sometimes the benefits are going to outweigh those risks. And that's what a lot of people need to understand, is that you have to sometimes take those risks to get the benefits that you're searching for.
Right. And quite honestly, we are trained in the area of functional medicine, and so are knowledgeable about the huge body of research, literature that supports that for a lot of people, hormones are very, very safe and offer a lot more benefit than any very small amount of risks. Right. So let's kind of break down and talk about maybe like one symptom at a time and how hormones play a role, and then maybe we can share a little bit about how hormones change throughout maybe a woman's reproductive cycle, and then as women get older, some of the common changes that occur, right?
Yeah.
Yeah. So you have children, right?
I do.
So do I. And we all know, let's say in the reproductive time frame, when a woman has babies, right? How do you feel after you've had a baby, right?
Miserable.
Right? Tired?
Tired, exhausted.
Yeah.
I mean, and you have that pregnancy glow, lack of.
Right.
I mean, after having children,
yeah,
you're just drained. It's like everything's taken from you.
Right. And most of the time we all just think like, well, I'm busy, I've got a baby, I'm not sleeping very much, I have all these other commitments and the stress of everything that occurred to my body. You know, maybe this is just how I'm supposed to feel, right? And that may not be the case. Something that women should know is that after we have a child, it's been studied, and it appears that your natural production of testosterone can drop by as much as 50% after you have a baby. And so I always like to share that testosterone, we'll talk about that a little bit first then. I guess it's a fun one. It's one of my favorites. But testosterone is viewed largely as a male hormone, right? It's a man's hormone. It's about building up muscles, and you can get roid rage and things like that.
Right.
But we know that testosterone for women can really have an impact. And
I mean, it can be a 360.
Yeah.
I mean, you can go from feeling so tired and no libido to all of a sudden you have increased energy. You're ready to go.
You want to share our friend's story? Yeah.
Well, yeah. I mean, one of our friends went from absolutely, no desire to started a very small therapy, and now, I mean, their life has changed. It's a complete 180 for them.
She's using injectable testosterone. She had just had twins. She's a super successful entrepreneur who has a fabulous business and a big team, and she felt miserable. And she'd come to me, and we'd checked her levels, and they were depleted. And I talked to her about the pros and the cons and the benefits, and she was very reluctant because of these beliefs and stereotypes about testosterone not being good for women. And then after maybe, how long did it take her to finally try it?
Years.
6 months, a year, a long time. And then now I don't see her anymore because she doesn't need me. She's fixed, right? Yeah. She feels great.
She
right?
does. She feels wonderful. So, and that's the thing, is that's one of those situations where the patient decided for themselves that the risk could lead to a greater benefit, and the benefit is there, and they're a full believer in therapy.
And honestly, for her, there was no real risk, right? The doses that we treat when it's
Very
done
small.
appropriately, the levels result in improvements in memory, mood for a lot of people, their ability to sleep better. That's an interesting thing. People don't realize how important hormones can be to facilitate good sleep. So sometimes people will have trouble falling asleep, or this other pattern of maybe they can fall asleep
But not stay asleep.
Exactly. They have this early morning awakening, wake up 3, 4 in the morning, and then have trouble getting back to sleep. And you may not realize it, but testosterone can have a huge benefit on calming down an overactive brain and helping people fall asleep and then stay asleep longer.
Progesterone.
Progesterone is another wonderful hormone for calming anxiety, improving mood, and promoting better sleep. Back to the other things, sometimes people ask about their metabolism and why they're gaining weight despite not changing any aspects of their life. And if you are experiencing declining levels of testosterone, one of the results of that is that your muscles will waste, something called sarcopenia. It happens as people get older, but it can also happen at younger ages if you deplete your testosterone. And so helping them maintain their muscle mass, muscle burns more calories at rest than fat tissue. So if you lose muscle tissue, even if you're eating the same amount of calories, you'll have weight creep. And so testosterone can promote good metabolism, But it's not a magic pill. You know, it doesn't work for everybody, but for a majority
Right.
of people, I think it can hold a lot of promise. What other? We were talking about thyroid.
Thyroid.
Yeah, and weight gain.
Yes.
The other thing that I think a lot of doctors may not address are issues of what are like optimal thyroid function versus just the reference range, what's called normal. Because
that's everyone's big question. Am I normal? Well, I mean, are you normal? I don't know. What is
Right.
normal?
Yeah.
I mean, you can look at the range and you have a number. So everyone wants to know, well, what's my number? That's what they want to know, is their number, their level. Are they normal? And I mean, you could be within normal range, but for you as yourself, an individual, it's not going to be your optimal level.
that's exactly right.
And that's where you come in to help supplement those.
For other people.
And,
Absolutely.
Or other people.
Yeah, hopefully other people. Most doctors, I hope, know about it. But Jackie's right. What the laboratory reference range says for what's normal thyroid function doesn't reflect what's optimal. And I think even the Endocrine Society has come out with a statement. The reference range says from 0.45 to 4.5 is normal. But if people's levels of the hormone TSH, I'm sorry, that's the number I'm speaking of, is greater than 2.5, they could really feel better if their level is at 2.5 or below, right?
Right. I mean, and that's the thing, is when you're discussing optimal levels and there's the suggestion of supplementing with a hormone, people kind of, well, I'm normal, why do I need a supplement? Because we're trying to get you to that optimal level to where you can feel your best and you're going to get the best benefits from treatment. So it is a personal decision, but there's always room for improvement on those levels.
Absolutely. And the other things that are important about thyroid are there are some, I not want to say obscure, but some parameters of thyroid labs that may not be checked all the time. And so the one number called TSH doesn't tell the whole story. Your free T3 level is very important. And sometimes people can have something called a blocking molecule, reverse T3, which will, it's a protein, and it sits on the receptor sites of cells, and it prevents their thyroid from interacting. So even though their numbers look normal, they really are functioning hypothyroid and may need supplementation. I wanted to talk about some of the fears, right? Because people think that hormone replacement is going to cause cancer and is very dangerous and blood clots. And just for the record, it's been studied extensively. Estrogen, taken especially orally, but any estrogen, increases our risk of blood clots, and that means birth control pills, hormone replacement therapy, whatever form of estrogen can increase that. And those risks are dangerous. Blood clots in your legs and in your lungs can be potentially fatal. It's very rare for those things to occur, but they do happen. Testosterone is blamed for all kinds of things.
I don't want a beard.
I don't want to grow a beard, exactly. I don't want to break out. I don't want to grow hair on my face. I don't want to be angry or have roid rage. And honestly, if you supplement patients' levels to higher than the reference range, but below some threshold that varies for other people, you'll feel better. You'll have improvements in your mood. If you go too high, then yes, you can cause problems like rage, anger, aggression, facial hair, stuff like that.
Things you don't want to talk about.
Right, the things that we don't want to happen, and usually we don't treat to that degree, but those kinds of side effects, sometimes a little bit of facial hair growth or breakouts, we can fix those pretty easily by adjusting your doses.
Now, what can you do, like when a patient comes in and their testosterone turns out to be too high?
For too high levels of testosterone, especially if they are having symptoms like acne or facial hair, there are supplements that patients can take. Something called saw palmetto is a natural supplement that you can take that will help decrease your level of testosterone. If your level was like dangerously high, when there's a number that we would look at. We could look for things like testosterone secreting tumors in their ovaries or their androgen secreting tumors in their adrenal glands. The other things that we can do to decrease the symptoms, there's a very, very mild diuretic. Do you remember we used to treat spironolactone sometimes patients?
Yes.
The patients with PCOS. Spironolactone is a diuretic, but at the level of the skin cells, it decreases conversion into a metabolite that promotes hair growth. So it will decrease facial hair growth. It can help clear up acne, can have some beneficial effects.
Benefit of it. Cleaning up your skin.
And birth control pills are another commonly used treatment for acne that is caused by high levels of testosterone. So they can help decrease testosterone levels functionally, and some women will notice that when they've been on a birth control pill, it will make their sex drive go down or their mood decline, and that can be due to a variety of factors, and sometimes it's from this effect of binding up their testosterone.
Right.
So testosterone, again, the risks, if we're treating males, we make sure that they don't have prostate cancer or elevations in the prostate secreting antigen tumor marker for that. If people have had a brain tumor before, testosterone can stimulate that kind of growth. Liver tumors, estrogen can stimulate those as well. So there are conditions that we look for. People who have migraine headaches that have flashing lights and stars called scotomata, classical migraines, are not supposed to take oral estrogen medication because it increases their risk for blood clots. So really, a thorough doctor is going to explore this history with the patients before just treating them willy-nilly and acting responsibly, I think.
And some of the responsibility lies on the patient as well. You have to be honest with your provider about your medical history. You have to be honest about how you are feeling, and don't exaggerate your symptoms, but you don't want to underplay them either. So honesty and taking that responsibility as a patient, it's very important when you're discussing these things with your doctor.
I always thought you were so great at that because the patients loved you and felt so comfortable with you that they would always share their problems, and sometimes that made our visits run long and we would run late in clinic, but they were getting helped.
Right, and it's that relationship that you want with your patients.
Yes.
We want you to come in and be honest with us, and we want you to feel comfortable to be honest with us. So I think building that relationship with them really does help.
Right. That's why I was so sad when you left.
sorry.
It broke my heart. Nina did a good job, and she's fabulous.
She is.
Yeah, and I know you're happy, and I'm happy for you. But I just want to we just wanted to promote a little bit of awareness about some of the things that hormones affect in our bodies, and how, I just want to close with the one other note. Patients come to us usually asking about their hormones because they don't feel well. But in the grander scheme, this body of literature from the functional medicine side of medicine has got tremendous evidence showing that in most cases, patients will not only feel better, but that using natural forms of hormone replacement therapy, especially as women are in menopause and men as well, andropause for men, it promotes better brain health, lower rates of dementia and Alzheimer's disease. It can almost reverse osteopenia and osteoporosis. The hormones can build good, strong bones. They help support metabolism, energy, promote better sleep, and cardiovascular health. The last point I want to give you is that those commercials that talked about testosterone and heart attacks were based on some very poorly designed studies with huge methodologic flaws, and their results have been questioned, and their conclusions, organizations throughout the world called for retractions of several of those articles because they were just not well designed, and the groups that they were looking at were not, it wasn't extrapolatable to the general population. So if people are living in fear of addressing hormone issues with their doctor because of some of those commercials that they've seen, please find a doctor who is knowledgeable about hormones, who can give you good information. Thank you so much for joining us. Thank you for being here, Jackie.